Hello everyone, welcome back to this channel. In today's video, we will learn about electroconvulsive therapy. Electroconvulsive therapy, also called ECT, it is made up of two words, electro and convulsive. Which means artificial induction of grand mal seizure. This artificial induction of grand mal seizure by using electrical current or by applying electrical current to the brain. And this ECT was first introduced by Bini and Carletti in April 1938. And from 1980 onwards, ECT is considered as a unique treatment for psychiatric patient or psychiatric problem. How ECT was done? ECT was done by applying electrical current through electrodes, which are placed either bilaterally, like in this case it's bitemporal, or bifrontal, or sometimes they put unilaterally on non-dominant side. For example, if a person is right-handed person, so the electrodes will be applied in the right frontal or right temporal region. And according to the American Psychiatric Association in 1978, they prescribed the standard dose for ECT. Voltage they give 70 to 120 volts, and the duration 0.7 to 1.5 seconds. And what are the type of seizure produced by ECT? Type of seizures produced after passing the current. What type of seizure produced? Grand mal seizure, which have a tonic phase lasting for 10 to 15 seconds, and clonic phase lasting for 30 to 60 seconds. Mechanism of action of ECT. The exact mechanism is not known, but there is one hypothesis which says ECT affects the catecholamine pathways between diencephalon and limbic system, and also involve the hypothalamus. How many types of ECT are there? Types of ECT. ECT has of two types, one which is direct. Indirect ECT was done in the absence or there is the absence of anesthesia or they didn't give anesthesia and muscle relaxants and nowadays direct ECT was not used anymore. And the second one is the modified ECT. Here in modified ECT was done under general anesthesia and with the use of muscle relaxants. Frequency or total numbers of ECT done. Frequency ECT usually done for 3 times per week or as indicated. And total number of ECT 6 to 10 or up to 25 times as indicated. Application of electrodes or how these electrodes are applied. In case of bilateral, each electrodes are placed about 2.5 to 4 centimeter or 1 to 1.5 inch above the midpoint on a line joining the trachea of the ear and the lateral canthus of the eye. And in case of unilateral, how the electrodes is placed. It is placed only on one side. It's placed on one side of the head. Usually in non-dominant side. Like for example, right-handed person, the electrodes will be applied. Electrodes applied at the right side of the head, or in case of left-handed person, the electrodes will be applied at the left side of the head. And this unilateral is much safer. It's safer than bilateral with few side effects. What are the indications for ECT? First one is major depression with suicidal risk, melancholia with psychotic features, etc. Number 2 is severe catatonia with stupor, poor intake of fluids and foods. Third one is severe psychosis with suicidal risk, homicidal, or danger of assault, etc. Fourth one is organic mental disorder, and fifth one is other indication, like in case of depression, ECT is preferred than antidepressant, especially tricyclic, in case of patient with heart disease. ECT is preferred than antidepressants like tricyclics in case of a patient with heart disease or cardiac disease, as tricyclic is contraindicated in this case. There are some contraindications in ECT. The first one is which is absolute contraindication. That means we cannot do ECT in this case. What is that case? Is the raised intracranial pressure. In case of raised intracranial pressure, ECT cannot be done. And the second one, it's relative contraindication. In case of cerebral aneurysm, cerebral hemorrhage, brain tumor, etc. And there are some complications associated with ECT, but there is life-threatening complications are rare, but fractures may happen. Especially fractures can happen in elderly with osteoporosis or dysrhythmia or respiratory arrest may occur in patient with cardiac problem, with heart disease or cardiac problem. What are the side effects of ECT? Side effects of ECT are like memory impairment, drowsiness or confusion, poor concentration, tongue bite, etc. And what are included in ECT team, or what are the facilities in ECT? In ECT team include a psychiatrist, anesthesiologist, a trained nurse, and a helper or a ward boy or nursing orderly. And in ECT facilities, the facility should have a pre-ECT room. In pre-ECT room, the room should be pleasant and comfortable. B is the ECT room. In ECT room, it is equipped with ECT machine, anesthetic agent or appliance, etc. And the third one is the recovery room. What are the role of a nurse in ECT? First one is the pre-treatment. In pre-treatment, the nurse should obtain detailed history, medical and psychiatric history of patient. Psychiatric history include allergies. Then obtain informed consent. Informed consent. Keep patient NPO for 4 to 6 hours. Withhold oral drugs in morning. Remove jewelries and empty bladder and bowel prior to ECT. During intra or during treatment, intra procedure, here the nurse should place the patient in supine position. Administer anesthetic agent, maintain vital signs and records. Number 3, post procedure. Post procedure, maintain vital signs, monitor vital signs. Place the patient in lateral position to prevent aspiration from secretions.